Hi, I'm Mike Arianis, and we're going to talk about multiple sclerosis and exercise. First, let's talk about what multiple sclerosis is, break down the pathophysiology behind it. MS is a progressive autoimmune neurological disorder where your immune T cells attack your own myelin on your neurons, and it degrades it. Myelin is a fatty tissue that surrounds the neuron that is essential for transmitting nerve impulses. When there is an absence of myelin, it can lead to a slowed propagation that disrupts the communication between the mind, the brain, and the body. And that can lead to a lot of symptoms that we'll talk about, that slowed propagation. Here on the left, this is a picture of a normal versus a damaged neuron, one with multiple sclerosis. Here on the left, this normal one, you can see it has a nice, healthy-looking, thick, white sheath of myelin there, and that's going to help the nerve signal travel down the axon nice and quickly. But here on the right, this damaged one, you can see there's missing parts here. It's segmented, it's damaged, and that's going to slow the signal that's traveling down the axon. So when diagnosing multiple sclerosis, women are actually a little over 2 times greater risk for being diagnosed. 60% of those diagnosed are female. Typically, people are diagnosed between the ages of 20 and 50, although it could be a little bit younger, a little bit older than that. Approximately 400,000 people are currently suffering from MS in the United States, and it's most common in Caucasian individuals of European descent. And we'll take a look at a world map that will exemplify that pattern in a minute. There's been studies that suggest there to be some sort of correlation between several genes and MS susceptibility, but there hasn't been anything conclusive that can pinpoint any one gene to be the actual cause of anything. So this is that world map, and as you can see, European countries, primarily Caucasian European countries, or countries that are populated by white European descent, like Canada and America, are at much greater risk than a number of other countries around the world. So some common symptoms and complications that can occur with multiple sclerosis include muscle weakness, symptomatic fatigue, numbness, optic neuritis, which is inflammation of the neurons in the eye, the nerve in the eye, nystagmus, which is involuntary eye movement, paresthesia, or an abnormal sensation feeling like pins and needles tingling feeling, spasticity, which are muscle spasms that can occur from the nerve propagation, visual disturbances, walking, balance, and coordination problems, and that can be a big effect with exercise, bladder and bowel dysfunction, as well as cognitive dysfunction, dizziness and vertigo, and there are a number of emotional side effects as well, emotional symptoms like depression and emotional changes, mood swings, and there's also a lot of pain that can occur. And we'll take a look at some medications that try to combat these symptoms as well. So as I mentioned before, multiple sclerosis is a progressive disease, meaning that it progresses as time goes on, so it can start out relatively benign and increase in severity. And there are different terms for different stages of MS that typically occur. The first one being relapsing remitting, where patient has relapses with full recoveries or some sort of deficit after recoveries, and there are no progression of symptoms in or during after recovery. Primary progressive is when the disease progresses from the onset with temporary plateaus and small improvements, but it's continuously worsening. So it's sort of like a graph, up and down, but still progressing. Secondary progressive is when it begins as relapsing remitting, but progresses without temporary plateaus or remissions. So that's pretty similar. Progressive relapsing is when patient has progressive symptoms from onset with short relapses with or without full recovery. And it's an interesting fact I found there at the bottom that within 10 years of being diagnosed, 50% of patients will become unemployed already just within 10 years. So it can progress pretty quickly, but it can also be relatively benign to some patients. So MS, of course, can have, with all those symptoms, can have an effect on the exercise response in individuals. Typically, patients with MS have a lower exercise tolerance. In a study conducted, patients with MS actually produced 20 to 68% less power during leg cycle ergometry, and patients with MS also produced 24 to 31% lower maximal aerobic power on the treadmill tests that they were performing as well. So as a general conclusion, you might say that they have a lower exercise tolerance, but each patient will have their own specific abilities and their own specific limitations when it comes to exercise. So it is important to consider that when prescribing exercise to anyone with or without MS. So these are some of the medications that I was talking about. Typically, you can kind of break them down into two groups based on what they're trying to do. You have disease-modifying agents, very popular one, beta-seron, interferon beta-1A or 1B, and then you have medications that just attempt to combat some of the symptoms, some of the nasty symptoms that can occur, and that can be like something like Provigil, which would reduce fatigue, something like Xanaflex or Baclofen, which are muscle relaxants, and that can help with the spasticity, the muscle spasms, and amitriptyline or Prozac. Those are antidepressants, but amitriptyline actually can also be used to treat pain as well, and prednisone, which would be used to help treat inflammation. And this picture here, actually, these disease-modifying agents, a lot of them are intramuscular, and these are the intramuscular vials of the beta-seron. So a lot of patients complain about the IM site inflammation or excuse me, inflammation or uncomfortability, and a lot of these symptom management medications are oral, so that's a little easier. So according to ACSM, American College of Sports Medicine, when prescribing exercise to patients with multiple sclerosis, they have a general guidelines that for aerobic exercise, the frequency should be about 3 to 5 days per week, at an intensity of about 40 to 70% heart rate reserve or an RPE of 11 to 14, for bouts of 20 to 60 minutes, or at least, if intolerable, at least 10-minute bouts. And the type can range from walking, jogging, cycle, elliptical. It can be inside, outside, on the track, on the treadmill. For resistance training, the ACSM guidelines suggest 2 days a week for the frequency at roughly 60 to 80% of the 1 RM for the intensity. 1 to 2 sets of 8 to 15 repetitions. If you are on the lower end of that rep range, you want to make sure to allow for enough rest between sets, training for strength. And the type can range from anywhere from free weights to body weight, machines, cables, TheraBands, anything that they can tolerate. A lot of what you'll find is it's catered to what they can tolerate, really. But these are some general guidelines. Flexibility is important to address because a lot of people with MS can suffer from limited functional capacity in the range of motion. So we stress that. So frequency could be 5 to 7 days per week, to the point of feeling tightness, slight tension, or discomfort. About 30 to 60 seconds for 2 to 4 repetitions. and we would be doing static stretching with like a strap or a dog leash or something. No dynamic or ballistic stretching here. So let's take a look at a case study. Meet Jen. She is a 52-year-old Caucasian female. She was diagnosed with relapsing remitting multiple sclerosis 14 years ago. She's currently taking beta-seron for her disease management and baclofen for her spasticity symptoms. So that was that interferon beta 1B, and this was the muscle relaxer. So that muscle relaxer especially could have an effect on exercise if she was currently on it. She's 5'6", 110 pounds, so she has a BMI of 17.8, so she's not obese. She has a heart rate of 80 beats per minute. That's relatively low for her age, I guess. Her blood pressure is 100/81 millimeters of mercury, so she's not hypertensive. She has reported to have poor balance, and you could see that when she walked in the clinic or the facility, whatever. She sometimes uses a four-wheeled walker to get around the house, and her cholesterol is 180 milligrams per deciliter. Her HDL's 65 milligrams per deciliter, and her fasting glucose 90. So let's risk stratify Jen. So her being under the age of 55, that's okay there. For her coronary risk factors, she does not have a family history. She told me that in conversation. She is not a smoker. I saw that on her history. She is sedentary, however, because of her MS symptoms. She is not obese, as we saw. She is not hypertensive, and she does not have dyslipidemia. Her HDLs are nice and high, so we can add a -1 to that. And she's not at risk for prediabetes, and she does not have a known metabolic, pulmonary, or cardiovascular disease, and is asymptomatic. So Jen, despite having the chronic disease of multiple sclerosis, is at a low risk for her risk stratification. And so for her exercise prescription, I would say that she should do, for aerobic training, about 3 to 5 days per week, 60 to 75% heart rate max, at bouts of approximately 10 minutes, whatever she can tolerate. So we would start out at a pretty low intensity for a low period of time, and slowly build up to work to a little bit more. And the type that she would do, she could walk inside around the track, maybe holding onto the railing or with her walker, or she could hold on to with the handrail support, going very light and slow on the treadmill, but under close supervision. And for her resistance training, the frequency would be 2 to 3 days per week, 60 to 75% of her 1 RM, on the lower end of that to start with, especially. And we would do 1 to 2 sets of 8 to 15 reps for each exercise. And I would want to emphasize her postural musculature, especially her core. And she could use anything like body weights, or her free weights, TheraBands, light cables, also under close supervision though. For her flexibility, I would suggest her to do that daily, to increase the range of motion that she stretches in as tolerated to slight tension or discomfort. 2 reps for each stretch, about 60 seconds. And like I said before, static stretching with like a strap or a dog leash or maybe a towel. That could be easy at home. And this is one last thing. There's a National Multiple Sclerosis Society, and they have the website right there, and you can make donations to MS. There's an MS walk, and there's a number of ways to contribute. So that's a good way to help out your MS society. So thank you. There's my references.